Texas is reporting more measles infections from an outbreak which started in January. Health and Human Services Secretary Robert F. Kennedy Jr. visited the state on Sunday to address the crisis. Alexandria Hoff has more.
Health officials in Texas are still working to stop the state's biggest measles outbreak in at least 30 years. Nearly 500 infections have been confirmed so far. On Sunday, HHS Secretary Robert F. Kennedy Jr. added a stop in Gaines County to his Make America Healthy Again tour to offer condolences to the families of two young children who recently died from the virus. Both were unvaccinated.
Even with no underlying health conditions, it turned to be a real tragedy.
RFK Jr. later wrote, quote, "The most effective way to prevent the spread of measles is the MMR vaccine." He has previously resisted calls to urge widespread vaccinations, instead saying it is a personal choice. He also says a CDC team is redeploying to Texas to address the crisis.
It's so far a fairly small number of people relative to what we're talking about. But certainly, if it progresses, we'll have to take action.
The outbreak is believed to have spread into New Mexico, Oklahoma, and Kansas, and local health officials expect it to last several more months. They are urging people not to delay care if their child starts developing measles symptoms.
The incubation period is between 7 and 21 days after exposure. A runny nose and a fever, we'd like for you to call your physician and get instructions on what to do next.
As of Friday, the CDC says the country has reported about 600 measles cases this year, more than double the number seen in 2024. In Washington, Alexandria Hoff, Fox News.
And with 3 confirmed deaths related to measles, research shows measles vaccines are at a decline here in western Wisconsin. In a public data sheet from the Wisconsin Department of Health Services, or the DHS, Monroe County showed more than a 20% decline from 2013 to 2023 for the MMR vaccine. And some say this could be a result of the pandemic.
I wouldn't paint vaccinations with a broad brush. There are certain vaccines that have had decades and decades of testing and experience, and we have seen firsthand the effect on public health.
Experts say in this day and age, with all the resources at our disposal, a child should not have to die of a vaccine-preventable illness. To look into your own vaccination status and see if you're up to date on your vaccines, you can visit dhfswir.org.